Now we're going to be talking about appointing an agent for the healthcare powers of attorney and a contact in the living will if you do one. Again, in this video we're giving you some suggestions on how to think about choosing someone. Nothing you fill out in this form is a final decision, and it's okay to ask questions, and we'll be talking through these in your appointment. When you're picking someone for these roles with a healthcare power of attorney, you want to be thinking about somebody who thinks like you would. When your doctor's talking to you, or when the nurses and the other medical teams have decisions to make, you want somebody who's going to think like you do and make decisions like you do. They don't need to know all of your answers or all of your choices. They just need to be ready to respond when they're called to make those decisions. There's no special medical knowledge necessary for this role, but of course, if you're lucky enough to have a doctor or nurse in the firm, sometimes it helps to have them in this role. It's also good to keep in mind that when appointing someone into these roles, they are not going to have to make the ultimate life decision to pull the plug. We'll talk more about that in your appointment. You also want to be thinking about somebody who can make decisions in traumatic and emotional moments. These can be incredibly difficult decisions to think about when they're making those decisions for you. If you're married and filling out this questionnaire, it's okay if husbands and wives pick different people for their backup roles. Typically, you are using each other in your primary role, but when you're looking at those backup agents and contacts, it's okay if you're picking different people related to your own families. And again, none of these are final decisions. We'll be talking more about what these documents do and how they operate in your meeting.